Welcome to arthroscopic knot tying. This video is designed to be used with the arthroscopic knot tying box provided by the St George's Shoulder Unit. In the box you will find an Arthrex knot tying block, a ring grasper, a knot pusher, a pair of scissors and some suture material. You need to know two forms of knot, a sliding knot and a non-sliding knot. In this video we'll teach you how to do the Duncan loop as a sliding knot and the Revo knot as a non-sliding knot. Practice each knot on the box trainer with a piece of string initially until you get the feel for the movements, and then when you're ready convert to using the finer suture and the knot pusher in a more simulated arthroscopic technique. One limb of the suture will be the post and the other will be the working limb. The post needs to be shorter as this will become significantly longer as you introduce the knot into the joint arthroscopically. Hold the post in your left hand and pinch a small loop of the working suture under your left thumb. Pass the working suture over the post and retrieve it 3 times. Try to neaten the loop as it passes over on each occasion, as this will make the rest of the knot easier. Then take the free end and pass it through the loop that you created previously. It doesn't matter whether you pass it from top to bottom or bottom to top. By gently pulling on both limbs of the suture, you can neaten up the knot. Then pull gently on the post, which will pull the knot down into the joint. To provide a temporary lock of the knot, pull both limbs of the suture in opposite directions across the knot stack. This step will be more obvious in the arthroscopic technique. To complete the knot, you need to lock it permanently, and this is done by applying 3 half hitches in a standard surgeon's knot fashion. Again, this is a technique which will need to be worked on arthroscopically to make knot security more reliable. To practice the arthroscopic Duncan loop, you need to pass the suture around the eyelet which is inside the jig and then retrieve it through the cannula using the ring grasper. As before, make one limb the post, but this time put the knot pusher on it. It's a useful trick to secure the knot pusher with a clip, as it may fall on the floor during the procedure and you usually only have one on the set. As before, make a small loop with the working suture and hold it in your left thumb, then pass the working suture over the post suture 3 times before completing the knot. With these smaller sutures, it's essential to keep control so that you don't have large suture strands which will just get in the way and make things more difficult. Pass the working suture through the loop that you're holding in your left thumb. Then, by gently pulling on both limbs of the suture and the knot, you can tidy it up before using a combination of pulling on the post and pushing with the knot pusher to deliver the knot down through the cannula. To provide the first lock of the knot, you need to pass point with the knot pusher and then pull on the other end of the suture to tighten the knot down. To complete the knot, you then need to do the 3 stacked half hitches. These are started outside the cannula, and then you can introduce the half hitch into the mouth of the cannula before using a combination of pulling on the post and pushing on the knot pusher whilst controlling the spare part of the other end of the suture to deliver it down into the joint. This needs to be done under direct vision so that you don't pass the knot pusher into the middle of the loop that you create. To secure the knot, you then need to pass point again as you did previously. The second half hitch is performed in the same manner, but you put the knot pusher on the other limb so that you're changing the post. This is then delivered carefully into the joint as before under direct vision, and then you pass point to secure the knot. The post is then reversed again back to the original post, and the third half hitch placed in exactly the same way. Once this is done, the knot should be locked securely. The Revo knot is a non-sliding knot used when the suture won't slide through the suture anchor. It is essentially a series of stacked half hitches. The first half hitch is a forward throw. This is then snugged down. The second half hitch is another throw in the same direction. This produces a knot which is secure but clearly not locked. The third half hitch is an underhand throw in the opposite direction. The net result of this is that you produced a surgeon's knot with the last two throws. The knot is completed by another forward throw, which is snugged down, and then this is followed by another reverse throw to complete another surgeon's knot on top. To practice the arthroscopic Revo knot, again you need to pass a suture around the eyelet within the simulator and withdraw it through the cannula using the ring grasper. As with the sliding knot, choose one limb to be the post and place the knot pusher on this. The first throw is a forward throw, and this is snugged down. The second throw is also a forward throw, and this is snugged down and secured over the first one using the pass pointing technique. The third throw is an underhand or reverse throw. Then this is brought down, just like before, carefully controlling the spare suture so that you don't create an inadvertent loop. Again, pass point, and this will secure the third onto the second, creating a surgeon's knot. To complete the knot, the next throw is going to be a forward throw, which will effectively put another surgeon's knot on top of the one you've already created. And if you want extra security, you can put another underhand or reverse throw on top of this, providing yet another knot. But this step isn't always essential, particularly with a braided type of suture, which is a little bit more secure. I hope you found this useful, and remember, the only way you can get any good at these is just to keep on practicing again and again.